On the Gary Bisbee Show, here are practical lessons from today's healthcare insiders. We'll uncover stories about their challenges, paths to success, and the skills that they've developed, as together we'll explore how the healthcare economy is transforming. NancyAnns DeParle has been a remarkably successful leader in both the public and private sectors. As Deputy Chief of Staff for President Barack Obama, she managed the legislative sausage-making process that delivered the Affordable Care Act, a major follow-on to the Medicare and Medicaid legislation of 1965 for increasing the nation's access to health care. NancyAnns has led the Department of Human Services in the state of Tennessee, as well as the federal Medicare and Medicaid programs. We will discuss the lessons that she learned by leading programs at both the federal and state levels. I can attest to the fact that she is a superb board member, having served on the Cerner board with her for multiple years. She currently sits on the CVS and HCA boards, and she has served on a number of boards through the years. What is the primary role of a board member? What lessons has NancyAnns learned? We will explore with her in this conversation. NancyAnns has an undergraduate degree from the University of Tennessee, a JD from Harvard Law School, and a BA and MA from Oxford University, where she was a Rhodes Scholar. Well, good afternoon, NancyAnns, and welcome.
Thank you. Good to be here.
Good to have you at the microphone. Why don't we start, if we could, learn a little bit about you, particularly to help us think through the progression of your career and how you've thought about decision-making and leadership. What was your life like growing up, NancyAnns?
Well, I grew up in a very small town in Tennessee, in the eastern part of the state, in Appalachia, called Rockwood. It's a town of around 4,000 people. I had a single mom who raised my two brothers and me on her own. And it was, my mom was from that area. She was from Rockwood and grew up there, and went away to Knoxville, which is not that far away, to get a nursing certificate, and then became one of the first Army nurses in World War II.
Wow!
And then came back to that area afterwards. She met my father, who was from Shanghai, in Knoxville. She was working as a nurse to an ophthalmologist there. And they were together for a few years and had the three of us children, and then they split up. So my mom came back to Rockwood to raise her three children, and was a remarkable person. But it was certainly my childhood was great in some ways, but not without hardship, and my mom worked very hard.
Boy, it sure seems like it. Do you find that the hardship that you went through, has that been useful to you in your career in any way?
It has been, Gary. It has been. That area of Tennessee, there used to be a lot of coal mining, and when I was growing up and running the Tennessee Department of Human Services, I actually got to go down in a coal mine. And when I came out of there, my reaction was, wow, I say I work for a living, and that what I do isn't work. And I feel the same way about my mom. She had to worry so much about just putting food on the table and taking care of three kids on her own. So it definitely gave me a perspective that I feel fortunate to have.
Yeah, that's for sure. Well, off to the University of Tennessee, and you were the student body president when you were a senior, I believe, first woman to be the student body president. What kind of special memories do you have about that?
This is a story that I often tell, especially groups of young women. I want to be clear that even though I was qualified and I had been the student body vice president, I would not have run had it not been for two guys, Scott Lucas and David Long, who were, one of them was president of the Interfraternity Council, and the other one was just a very active guy on campus. And they came to me and they said, you should run. And my reaction was, oh, no, one of you should be it. And they said, no, you should run, and we're going to run your campaign, which they did. And I remember actually we persuaded two of the Tennessee basketball players who were very popular at the time, Ernie Grunfeld and Bernard King. You might remember them, the run and gun players, to campaign for me. Anyway, it was a lot of fun.
Was that the origin of your interest in politics?
The origin of my interest in politics, I don't remember a time when I wasn't interested in politics.
Where, can I ask, did the interest in healthcare come in?
Probably from my mother and a bit from my grandmother. So both my grandmother also raised 3 children on her own. And she walked to work every day, a couple of miles in Rockwood, and worked as a nurse, not with a certificate and not with anything but on-the-job training, but for the local doctor. And then my mother had also been a nurse. And, there was a long time when I thought I might be a nurse. I have a vivid recollection of sitting at my grandmother's kitchen table with her. She had a little shoebox where she had her bills, and she was holding, one of her bills from Blue Cross. And she said, President Johnson just signed this bill called Medicare, and I wonder if it's going to help me. It's funny the things you remember, but I do remember having that conversation with her. So it's always been something that interested me. And then for a sad reason too, Gary, because when I was in high school, my mother, who was the center of everything to me, when I was a junior in high school, she was diagnosed with lung cancer. And so the rest of my time in high school was spent, worrying about her, taking her to treatments. She went to radiation treatments in Knoxville, trying to help her get through that. She ended up dying during the Christmas break of my freshman year in college. So I came home from the University of Tennessee, and she was in the hospital, and she died 2 days after Christmas. So I think that also is a reason why I was very interested in healthcare. She was sick with pneumonia and obviously cancer, but the precipitating cause of her death was not the cancer. I mean, it would have killed her, but the precipitating cause was that she had gone back to work when she shouldn't have, and had gotten pneumonia because she was so weak, her weakened immune system, because she was worried about losing her job, losing insurance, and that we wouldn't have insurance. So that was wrong. And anyway, healthcare, I guess that's a big part of why I got interested in healthcare and healthcare policy.
Well, we're better off now than when during those days, although we still have a ways to go. Well, on a happier note, you're off to Harvard Law School. Were you thinking about being a practicing attorney, or what was your rationale there?
Well, as I said, growing up in this small town, I looked around for role models, and my role model was my uncle, my mom's younger brother, who was a lawyer. And I used to go over to the courthouse in our county seat, Kingston, and watch him try cases. And you're going to think I'm making this up, but let's put it this way. If you ever had anything go wrong in that area of the country, you should run, not walk, to get him as your lawyer. He would get in front of the jury, and virtually everyone on there, the judge would be, question the jury to make sure they could be impartial. Does anyone on here know Mr. Cooley? Everyone put their hands up. Well, how do you know him? Well, he helped my brother with whatever, and he was paid sometimes in livestock. This was a different time. But what I loved about watching him in the courtroom was, how smart he was, how I viewed law as a way to help people, because that's what he did. He solved problems and he helped people. And I worked in his office when I was in junior high. He hired me. I'm sure I wasn't that much help, but to answer phones for him after school, probably just to give me that exposure. And I would see all the people coming in and sitting in his waiting room and calling him. And it seemed to me as often as not, he brought people together who were arguing over something and helped them resolve their conflict. So anyway, that's what I wanted to do was be a lawyer, be someone who made a good living, worked hard, was smart, helped other people. That seemed like the ticket to me.
Well, you've done all of that for sure. Where did the Rhodes Scholarship idea come in?
Well, when I was a senior at the University of Tennessee, I was a history major, and I was in the area where the history faculty had their offices. And this professor named Milton Klein, who was a very well-known professor, his main interest was New York history. So he was kind of an expert on that. He stopped me in the hallway and he said, "Hey, look at this article. They're now letting women get Rhodes scholarships. You really ought to consider applying for that." So he gave me this magazine. It was People magazine. And it was an article about the first class of women Rhodes Scholars. The problem was that the article was written after they got to Oxford. So it was November or so of that year. And you had to apply for it like in September, October, something like that. So I missed the deadline. I was a senior. I had a serious boyfriend. I was determined to go to law school. So I kind of dismissed the idea, to be honest. And then the following fall of 78, I was at Harvard Law School, my dream. And I started thinking, and this shows how naive I was, but I started thinking, gee, I'm not even 22 years old. I'm going to be doing this for the next 3 years in law school, and then I'll be out and I'll be practicing law for the rest of my life. So shouldn't I try to do something different? I know you're laughing because I haven't done it that much, but anyway.
It's just, we're all at 22, Nancy, and we're all that way, but go ahead.
A young person's, myopia or whatever. So I thought, well, maybe I should do what Professor Klein said. Maybe I should look into that. And then I also applied to the Kennedy School because they had a program at the Kennedy School where you could get a joint degree. And again, my interest in politics, I thought, well, that could be interesting and that might be something I'd look into. And so I applied, not having any idea really how competitive it was. And then I won. And I'm embarrassed to say this, but I actually considered not going. My grandmother, my mother's mother, my grandmother, who really helped my mother raise us 3 children, said to me, "Oh, don't do that." I said, "Well, why, grandmother?" "Well, it's cold over there. I don't think you're going to like it." "Well, okay, but we can deal with that." "Well, why not?" She said, "Well, because you'll never get a husband if you do that." And at the time, Gary, I didn't really care. And there might have been some truth to what she said. It might have narrowed my scope in some way. But anyway, I not for that reason, but for other reasons, I did consider not doing it because I had a scholarship at law school. I would be stepping out after my first year. It seemed more complex than it did when I'd sent off the application. But anyway, it changed my life. I'm so grateful that I had that opportunity.
So the Rhodes Scholarship, what was your project there? You had didn't each Rhodes Scholar have a specific study or project?
Well, I studied, if you were doing a PhD, a DPhil in Oxford parlance, then yes, you would have a dissertation just like you would here. What I chose to do instead was to do a second BA, bachelor's degree, which in Oxford parlance is also transformed into an MA. So I have a BA / MA in politics, philosophy, and economics. And I studied, you do 8, they call them papers when you're doing that. So I took economics, I took monetary policy. Against the advice of my tutors, I took modern British government. Most Americans who go over there, one of the offerings is to study U.S. politics and government, and you're pretty much guaranteed of an alpha or an A in that. But I thought, well, I know a lot about American politics. I want to learn about British politics, so I took that. At the time I was doing it, the U.S. Embassy had this program that they asked me to join, where you would get to go out in the English towns and villages and give talks about the U.S. government and policy in the U.S. And I did that. So I went to Wales and stayed with a family. And anyway, it was a great educational experience for me.
Well, back to Harvard, wrapped up law school, went to practice for several years. How did the appointment at Tennessee, the agency that runs Medicaid, how did that appointment come about?
Well, actually, it's not the agency that runs Medicaid. That isn't what I ran. What I ran was the Department of Human Services. But I'll tell you how that came about. So the governor of Tennessee was a man named Ned McWhorter, who had been the Speaker of the House for 20 years before that. And when I was the student body president at the University of Tennessee, one of our activities was to pile in someone's car and drive over to Nashville, 2.5, 3 hours, to lobby the state legislature, because the state legislature controlled our tuition, pretty much everything about our lives as students. They set the policy for. They appointed the board of trustees, all of that. So I'd gotten to know then Speaker McWhorter during that time. And when he ran for governor, I helped him. I was practicing law. So when he was elected, he called me up and asked me to come talk to him about joining his cabinet. And I originally lobbied for, I thought, insurance commissioner, because I'd been doing some, I was a litigator. I've been doing some work representing insurance companies. And he said, no, that isn't what I have in mind for you. I want to work on indigent healthcare. I want to get people covered in this state. There are too many. When I was campaigning, I met too many poor people who don't have coverage. And I want you to run my biggest department, which was the Department of Human Services. And I want you to go to Washington and throw your weight around. And he was a 6'4" or 5" former football player, and I'm not. So it was sort of a joke between us that I was going to come up here to Washington and throw my weight around. He was very crafty. He said, so also, I just need to warn you that I'm going to need you to do a RIF, a reduction in force. And I said, well, I did have, I was way too young to be doing this job. Let's start there. I forgot to say that part. I was 30 by the time it was announced, by the time he was inaugurated. And I said, well, okay, what do you mean by a reduction in force? And he said, well, there's about a 10% reduction in force. And I remember sitting there and thinking, okay, there's 6,000 employees at the Department of Human Services. So that's about 600. That'll be no problemo. I had no idea how wrenching, doing something like that would be. Also, my department had a very heavy concentration of the people in our state government who were members of the State Employees Association, which was a union, basically. So they were not exactly in favor of doing a reduction of force. Also, members of the legislature didn't like it because they had gotten people appointed to these jobs. In many parts of Tennessee at that time, if you wanted a white-collar job and you didn't want to be a teacher, this was the best job because we had an office in all 95 of the counties in Tennessee. So anyway, it was a very difficult experience. I traveled, I drove to all 95 counties to sit down with our employees, explain it to them, and we went through the process. And after I left that job, I decided I could never be scared of anything again because that was a trial by fire for sure from a the standpoint of managing a large agency. But what I loved about it was, I mean, you can be so close to what really matters to people. So my agency handled really a lot of the problems that people have, whether it's child abuse, foster care, adoption, elder abuse. It ran the welfare payments, the AFTC. It did the eligibility determination for Medicaid. So it did meet and work with all the people who wanted to try to sign up for Medicaid. In fact, one of the first things I did was go through that process. I showed up at one of our offices and just tried to go through it. And we had a simple system compared to most states because we had one agency, so you didn't have to go to several agencies. So we had one agency that did AFTC, food stamps, child support, Medicaid. And it was still a nightmarish, process. So that was one of the things I worked on, was simplifying the eligibility process. Outstationing eligibility workers for Medicaid at some of the big public hospitals, so that when someone showed up who was really eligible but had never signed up, you could get them signed up for Medicaid. So we did a lot of things that I'm proud of. And I did work on the governor's plan to get more people covered, which became TennCare.
How did that experience inform your stop in the federal government as the administrator of HCFA?
It may have been a rarefied environment and I didn't realize it. But we worked together on a bipartisan basis in Tennessee. Yes, there was politics, but when we were working to pass a bill, when we, the governor and his team, were working to pass a bill, no one told me any different. So I didn't just go to the Democrats in the House. I mean, he had been Speaker of the House for years. He knew exactly who I needed to go to. He told me to go to everybody, try to get their support, which is what I did. So I learned to work with both sides, and I found there was a lot more that we had in common than we disagreed on. And I found that people were willing to listen. Same with the providers. TennCare, at the essence of TennCare, was taking the Medicaid disproportionate share dollars that under the federal formula went to hospitals that to compensate them for caring for a high number of uninsured people, which in Tennessee there was a high number of uninsured people. We took those dollars with a federal waiver approval eventually, not while I was there, but it happened afterwards. And we used those dollars to cover individuals. So instead of going directly to the hospitals, they went to individuals who would then come to the hospital with coverage. And that became a Medicaid expansion. That's what TennCare was. Well, the hospitals could have said, no way, we're getting this money. Yeah, we want you to get people insured, but don't take this money away from us. I need to be able to count on these revenues. And instead, they worked with the governor, and they were nervous about it. Don't get me wrong, because they're basically giving up something that they had under a formula to agree to let people come in the door with coverage. But they worked with us, and they worked with Governor McWhorter, and they got it done. They got an expansion of coverage. So in the back of my mind, and maybe, again, I was too young to know any better at the time, but at the back of my mind, I thought, it's possible to get things done. It's possible that people will, if not work against their own interests, people don't do that, but people will listen to reason. People will try to meet you halfway. Yes, people are rational economic actors, but they can be persuaded to put the interest of everyone on at least equal footing, if not ahead of their own interests. They're willing to look at it, because we were able to do that in Tennessee.
I mean, that's a lead in to your time as the Deputy Chief of Staff for President Obama and all the sausage making that led to the ACA, which was highly political, obviously. What kind of lessons now, looking back on that, what lessons did you take away from that whole experience?
Look, Do I wish I were clairvoyant about policy and how each thing would work out? Of course I do. But the only thing I would really do differently is I would have had Republican support for our bill. And when I joined the White House, and you'll remember this, Gary, because I talked to you about it right when I did it, I really believed that after 10 years of bipartisan, strange bedfellows kind of discussions about how to achieve objectives like lowering the cost of care, reforming the insurance markets so that people with pre-existing conditions didn't have to be excluded, getting everyone into coverage, an individual mandate, everyone having the responsibility, and if they couldn't afford it, getting some assistance. Those seem to me, again, maybe I was in a bubble, but those seem to me to be bipartisan objectives that people all agreed to. And so I did think coming into this in 2009, I wouldn't have taken the job if I thought this is going to end up being partisan and there will not be a single Republican vote for President Obama's vision. And I know that isn't what he thought either, because we talked about it. Again, I ruined a bunch of pairs of shoes if and didn't get the memo about not working with Republicans, because I spent a lot of time listening to them, working through their issues. In the end, there were some hot button issues for them that were not included in the law. And a lot of their ideas were in it, and yet they couldn't vote for it. So what did I learn from that? Well, I learned that politics can be ugly. And that, but look, I wouldn't change. People have sort of teased me about you wasted all that time. And actually that's a bit of how some progressives now look at the legacy of the Affordable Care Act and the time that we spent, and say we wasted that time. We should have just passed a bill that had the public plan in it and a more expansive set of subsidies and the things that progressives really wanted within a few months of the president's election. We shouldn't have tried to work with Republicans. I think they've forgotten that it's not like we had 60 votes at the beginning, first of all. And secondly, that just isn't who President Obama is or was. He wanted to work with Republicans, in part because he had studied history and he knows that the stronger legislation that has bipartisan support is stronger. It just is. So do I think we still would have had a lawsuit against the law the minute the president put the pen down from signing it? Probably. There was a set of actors who were kind of determined to do that no matter what. But I do think it would have been easier. The last 10 years would have been easier of implementing the Affordable Care Act had it not been for how polarized things got.
It was, and in a way, kind of was, I think, for the general public, the first real sign about the hyperpartisanship that we're in now. I mean, that was, you just kind of took the brunt of that. Segueing to the current administration, the Biden administration, what advice would you give them regarding the ACA and the moves that they're making there?
I haven't sat silently, for sure. I've given them some advice, and among my advice is to look at California, to look at the states where it's been very successful, both in getting a lot of people covered and in having competition, holding premium rates down. I believe last year in California, the rate increases were less than 0.5%. So why is that? It's because California went all in. It's because California expanded Medicaid and told the plans, if you want to be in Medicaid in California, if you want to be part of Medi-Cal, great, we'd love to have you, but you also need to participate in the marketplaces for the uninsured. And they've spent their own money on doing marketing and enrollment in California. It suggests they have spent money. Even so, the so-called young invincibles have been hard to bring into the marketplace. And it does appear that one thing they've learned is that the tax credits to defray the cost of premiums and the subsidies are important. They just went through a round about a year ago of improving that in California, and it's made a difference in getting people into the market. So there's a whole playbook from California of how you go about strengthening this law. And by the way, it doesn't involve a public plan. They haven't had to do that. They have plenty of competition. So I believe that we can do that. I believe President Biden has already taken a start towards that and what just passed the Rescue Act. So that's what I would do. I would build on that foundation.
It appears he is doing that, and that's the right thing to do, in my opinion, as well. Let me ask a question. This is a leading question because it's hard to escape the football over your left shoulder, and I know right above that there's a case with a pretty important pen in it. Can you share that story with us, Nancy-Ann?
Sure. So the box is a fancy box that they gave me with one of the pens that the president used to sign the Affordable Care Act with. The football below that has the presidential seal on it. And as I was sharing with you earlier, Gary, a lot of people see that in my Zoom background and assume that it's a Peyton Manning signed football from my Tennessee Vols, but actually the seal on it is the presidential seal. And it was signed by the 4 military aides to the president who were there when I was serving as President Obama's deputy chief of staff. And the night before I left the White House, which would have been January 19th of 2013, there was a knock on my door in the West Wing, and I opened the door, and the 4 military aides were standing there holding the football. And the football has special significance to them and to me because they travel with the president everywhere, and they stand outside his door no matter where he is. And they are carrying a big suitcase that weighs 60 pounds. And I know this because I picked it up at one point. And inside that suitcase is a machine that has the nuclear codes in it. So that is the so-called football. And so that's why they gave me a football. And anyway, it has a special place in my heart because all of them have a special place in my heart because of I got to spend a lot of time with them when I was traveling with the president, and to hear their stories of their service to our country, to see what fine young people they are and leaders of our military is really inspiring.
Well, speaking of service to the country, many of us are very grateful to you, Nancy-Ann, for the service that you've given the United States. So well done. On to private equity, where you've spent time and clearly a key outstanding leader in that space. Can you just share briefly your thoughts about private equity and what you're doing now?
What I have done is work with really the same set of people for, on and off for almost 20 years. And what I love about it is finding innovative healthcare companies that are doing something to improve healthcare, whether it's making it more efficient or more effective, higher quality. And I love that about healthcare. You and I have talked about this. There's as long as I've been around it, a day doesn't go by where I don't meet another company or see something new that's happening. It's really, really exciting. And I think private equity can fill a very important place in our sort of ecosystem around getting businesses to where they can, grow and help people. Our former friend and colleague, Neil Patterson, thought so too. He and I talked about it a lot. Often the companies that we invest in, Gary, are family-owned businesses, still founder-owned, like the company you and I worked with, that someone just had an idea and was stubborn and kept working on it and building it, and finally it got traction and it's helping people. And then we come along and we help them grow it further. We help professionalize them in areas where maybe they haven't been professionalized. We help them make connections to other entities they can sell to if they're a company that sells a product. And it can just be a lot of fun just to build these businesses. One of the businesses I was fortunate enough to work on was a company called CareMore, and we backed a man named Alan Hoops and a woman named Leva Lesson, who'd been part of Pacificare, which was a Medicare plan focused on seniors. Really, I think the first one that just focused on seniors, which they had sold to United, and then they decided they wanted to get back into the business. And so we backed them to buy a physician group in California that was practicing medicine differently than others, had a very low medical loss ratio cost, but it wasn't because they were stinting on care. It was because if you signed up with them, they spent time with you, they went to your house, they took the throw rugs out of your house, which is often with seniors, falling and breaking your hip is the reason you end up in the hospital. And that's not a good story the way that usually ends. It was very high tech, high touch, a very different model for Medicare managed care that was really successful. And I remember when we made that investment, thinking, going out and meeting with some of our members, our beneficiaries, and thinking, well, this could end my career. I don't know if this is a good investment or not, but I know this, they're taking good care of people. And it turned out to be a good investment too. So that's obviously, what a wonderful gift that is to be able to do that kind of thing. It's a lot of fun.
Let's talk for a moment about your directorships. I sat on a board with you for a number of years. You're just an absolutely terrific director. And, you're on the CVS board now, you're on the HCA board. How do you view your role on a board, and particularly the kind of leadership you can provide a company through sitting on a board of directors?
Well, it's a great experience. And you missed this, Gary. I said you trained me, which is true. You'll recall that my first board meeting with you, I was nursing an infant. I brought not into the boardroom, but he was there with me. He came to Kansas City with me. What I like to do in my career, and personally too, I guess, is be part of working with people that I respect and I learn from on a mission that I think is important. And at its best, that's what serving as a director can be. You are representing shareholders. You are trying to get the best value, the best long-term value and growth for their investment. And I think about it as though I'm representing, a public pension plan. I'm sitting there thinking about my mom, who was a state employee. How do we make sure they get a good return? And it's by asking questions, it's by learning the business, getting to know the management team, making sure we have a good succession plan and a deep bench, all the things that you and I did together. And it's the same no matter whether it's a private company that Consonance owns or a public company like CVS or HCA. It's all those same factors that play into what makes them successful. And watching companies like CVS and HCA this past year has been especially uplifting, because with this pandemic we've been through, our industry, the healthcare industry, has, I think, shone brightly. Just the number of lives that have been saved either through testing and vaccinations that CVS is now helping to distribute, or certainly the direct patient care that HCA has provided. Our nurses, our doctors. I mean, it's really been an awesome sight, and so it's rewarding for me as a director just to be part of that enterprise and to try to help support what they're doing.
Let's turn, if we could, NancyAnn, to women and women leaders in particular. You've been active in that regard. We appreciate your time at Her Story earlier. That interview was just terrific. I remember a story that you shared about advice that President Obama gave you. I think it was maybe in the Roosevelt Room. Do you remember that story? Could you share that with us?
I remember having a dinner with him one night with other women in the White House that he actually asked us to have dinner with him. So there were maybe 15 women there, and it was, I ran over, it was during my beginning days there, and I was doing something on the Hill, and I was told, oh, come back, the president's asked you to have dinner. So I go into this thing, and it turns out that it's that Valerie Jarrett, one of his senior advisors, had asked him to do it. And it was because some of the other women were complaining a little bit about the male-dominated culture at the White House. And he said to us, words to the effect of, okay, I get it, and I'm going to be paying attention to this, but I need you all also to know that I chose you because you're strong and because you are able to show up, and this is life in the West Wing. You need to show up for yourself. And he was true to his words. He was true to his word. There was a time when I went through something that felt a little bullying, and I would have never said anything about it. I was standing by, there's a copying machine outside the chief of staff's office, really across the hall from where my office ended up being. But at the time I had an office over in the old executive office building. And I'm standing there making copies of something for a meeting. And you don't know this feeling, Gary, because you're tall, but when you're not that tall, there's a feeling of when someone's standing over you, like casting a shadow on the Xerox machine. And I felt that, and I looked around, it's President Obama, and he puts his hands on my, kind of like this actually, on my shoulders. And he says, hey, I heard that some people are giving you a hard time, and I just want you to know I've got your back. And so I didn't hesitate, whether it was walking into the Oval Office in the middle of a meeting when I thought he needed to hear my perspective, or at any other time, telling him, giving him my counsel, which is a pretty heady experience for somebody from Rockwood, Tennessee to be, but he wanted that. He wanted to know, he wanted you to be completely and utterly authentic with him. And so I was. The story I thought you were going to ask me about, which is one that I had forgotten, but another young woman tells about me, and I didn't even remember it, but she wrote an article about it, her name is Raquel Russell, and she had worked for Senator Tom Carper, and I had spotted her on the Hill, thought she was really smart, so recruited her to come to the White House. And she was in the Office of Public Engagement, I think, doing urban policy. And so she was invited to this meeting, and I get to the meeting and I look around and I see Raquel. So in the Roosevelt Room, there's one big table that seats maybe 20 people. And then there are some chairs on the outside of the perimeter of the room. And I see Raquel sitting in one of those outside chairs. And the room's not completely full, but I looked at her and I pointed down at my BlackBerry. This is back in the day when that's what we had. And she looked down at her BlackBerry, and I had written to her, sit at the table. And she tells the story of how she felt embarrassed that I had noticed, and that she realized that she was feeling like an imposter being there, and that it made her realize that, and I talked to her later and said, look, if you're in the meeting, it's because I want to hear your perspective. I want you, showing up for yourself. And by the way, no guy I've ever known, including my son, who was at that point like 10 years old, would hesitate to go sit at the table. So you need to sit at the table. So she says, she learned a lesson from that. So we try to pass that on. But it's not that easy to do. It is something that, that with my experience, I've learned, sit at the table, but Raquel had to learn that. Now she's passed it on.
NancyAnns, this has been an absolutely terrific interview, by the way, as expected. I'd like to ask one final question if I could, because your career really is typified by working in the private sector and the public sector. You've been an outstanding leader in each sector. What advice would you give a young person that might be in the public sector thinking about going to the private sector or vice versa?
I can't imagine a better path. It might seem a little circuitous, the one that I've taken, but it's been so challenging, interesting, never a dull moment. So I would say just try to go with your gut to some extent. I didn't exactly do that the last time I went into government. I really agonized because I thought I had done my government service. I had run the Centers for Medicare and Medicaid Services, which is the thing I wanted to do. And I love that experience. And I just was getting established as a business person, working with you on the board that we served on, that I was really enjoying. So it was a lot to walk away from all that and to go back in and try to get something big done. But my goodness, I wouldn't have missed that for the world. So I would say, the president says, dream big dreams. President Obama used to say that. So I'd say dream big dreams. And whether you're in the private sector or in government, really try to get something big done. You can. It's within the realm of possibility. Just if you can dream it, you can do it.
That's great advice. And as Neil used to say, this is a good place to land, NancyAnns. Thank you for your time. Very much appreciated.
Thank you.